Prepare to have your health questions answered here on Safe, Effective Natural Solutions with Dr. Todd Binkley, owner of Binkley Healing Center in downtown Ventura. Now, here's Dr. Todd.
Good afternoon. I'm Dr. Todd Binkley, board-certified doctor of non-force chiropractic and practitioner of functional medicine. The title of the show is Safe, Effective Natural Solutions to Almost Any Health Challenge. What does that mean, almost any health challenge? Well, if you're bleeding or you have an acute infection and a fever, if you can't walk, go to the hospital. Everyone knows that. But I mention that, I describe it that way because if you can walk and you're not bleeding and you don't have a fever, you don't have something that obviously requires immediate medical attention, there's a very good chance that there is a solution for that can be identified with proper testing. And that sometimes surprises people because a lot of people who come to me have already been to 1 or 2 or 6 other doctors and been told there's nothing wrong with you. Well, that drives those people crazy, obviously, but it drives me crazy too because it's not true. It's dishonest for doctors to say that. Doctors do tests that they know to do to identify medical conditions. And if they do those tests and they can't find anything wrong on those tests, what they should say is, I can't find anything wrong with you. That's true. I can't find anything wrong with you based on the test that I just did. Come back when you're bad enough to need medical care. That's the truth. That's what happens in most medical office visits that end in a question mark. Sorry, or a false statement like, there's nothing wrong with you. We've tested everything. You're fine. That's not true. If you don't feel fine, you're not fine. If something doesn't feel right, that's because something isn't right. You just haven't figured out what yet, and your doctor hasn't figured out what yet. And that's really, really common. That's the frustrating thing. It's much more common than you might imagine, and there's a whole host of reasons for that, but the main ones, there's just two main reasons. The two most common reasons for that are, number one, the practice of medicine is not to check whether or not you're healthy. It often won't identify the cause of everything that ails you. The purpose of a standard medical visit to your medical doctor, your general practitioner, your OBGYN, whoever your main doctor is, your primary care provider, the purpose of that visit is to determine whether or not you need medical care. Whether or not you need medical care is not the same as, are you healthy? It's not the same as, is there anything wrong with you? There might be half a dozen things that aren't perfect, that aren't right, that need some help, but they're not bad enough and they don't fit the criteria to warrant a prescription or a referral to a specialist or another diagnostic test of some kind, a scan, a CT, an X-ray, etc. If you don't need medical care, then you leave a medical doctor's office with no hope, no solution. Functional medicine means restoring normal function. We use the same tests any other doctor uses, mostly blood tests, but also other tests, stool tests for gut microbiome issues, hormone tests, neurotransmitters, hair tests and urine tests for heavy metal and chemical toxicities. These are some of the most common tests apart from blood tests. And, most things you can measure in blood, but some, like the ones I just mentioned, are better identified in other bodily fluids like stool, urine, hair, saliva, etc. But the point of functional medicine is to identify whether or not normal function is happening in your body. What did your blood tests look like when you were in your teens and early 20s and everything was working perfectly and your body was exhibiting 100% normal function, normal physiology? Everything is working as it should. So functional medicine means at any time in your life, you can use the same blood tests, standard blood tests, but in addition to the medical range to determine if you need medical care. That's important. We always do that too. But we also add this narrower range. For most tests, it's roughly the middle third of the broader standard medical range. So just stick your arms out as wide as you can. This is my visual. This is what I do when I describe this in live presentations. This broad medical range determines whether or not you need medical care today. Bring that in to the middle third. And now you're looking at what normal physiology is like for most things. So the middle third of the test for your liver and your kidneys and your digestive system and your immune system is roughly what they should look like when you're healthy, when normal function is present. And that's not the practice of medicine. So you never get that if you just go to someone who practices standard medicine who is not a functional medicine practitioner. Some MDs do practice functional medicine, but very few. So thank you for tuning in. We've got an exciting show for you today. It's in the middle of a series I'm doing on the 12 most commonly overlooked causes of fatigue. So we've talked about, in the previous 2 episodes, we've talked about insufficient protein. We've talked about chronic subclinical gut infections, meaning something that's been around for a long time but isn't bad enough to cause a fever or other obvious signs. So you have a low-grade infection in your gut, sometimes elsewhere too, sometimes in the gums and sometimes in the sinus. For example, one of the common ways that this shows up is a low white blood cell count. Most of the time when you get a standard medical workup, especially if you have a fever, if you have signs of a cold or a flu or any other kind of infection, a stomach flu, etc., they're looking for an elevated white blood cell count. That's part of the way you confirm that diagnosis. When you have an infection, your body ramps up production of white blood cells, and then there's a whole bunch of different types of white blood cells that are also on a standard complete blood count. But when that is elevated, that's a standard response to an infection. Your immune system ramps up production of the various types of white blood cells you need to fight off and kill that bug. But people often also have subclinical infections, meaning what does that mean? It means your white blood cell count goes down. What if your white blood cell count is only 4 or in the 3s? Well, again, the broad medical range, the low end of the standard medical range on LabCorp, which is, it's pretty standard across any kind of lab, but I think on LabCorp it's 3.4 for most people. The ranges also vary by gender and on your age for some tests, but for a complete blood count, they're pretty similar for anyone. The medical low, they're not going to pay any attention to your white blood cell count and be concerned about it unless it's below about 3.4. Well, the functional range, we're concerned about it. Your immune system is definitely needing some support if your white blood cell count for most people is below about the mid-5s, 5.5, 5.6. So if your white cell count is 4 point something or less, that is the classic sign that you've got some kind of subclinical infection, some kind of bug, a virus, a bacteria, a fungus, a parasite, somewhere, usually in the gut. Sometimes the 3 most common places to have an infection that you don't even know about because it doesn't cause a fever. The only symptoms are usually fatigue. That is the most common and often the only symptom of an infection that your body's never been able to completely fight off. It mainly shows up, among other things, the easiest way to identify it is a low white blood cell count down into the 4 or less category. Last week, we also talked about subclinical hypothyroidism. So same word, subclinical, that's a little bit of an uncommon word. Subclinical just means doesn't show up on a standard medical test. It's not a concern in an average medical clinic. It's below that. It's flying under the radar. It doesn't meet the parameters that warrant medical treatment. It's flying under the radar. You've got it. It's causing a problem, and you have to narrow the focus and use a different metric, a different yardstick when you're reviewing those tests to identify them. But also really common. Last episode was all about hypothyroidism that a lot of people have. Millions and millions and millions, especially of women over 50, have low-grade hypothyroidism, even when they just went to their doctor and he or she told them that their thyroid was fine. That's usually not true. So 4th on the list of the 12 most commonly overlooked causes of fatigue is pre-diabetes. Not full-blown diabetes, pre-diabetes, and this has very specific definition. The diagnosis of diabetes is based on your fasting blood glucose first thing in the morning. If that is above 125 on 2 separate occasions, that is a diagnosis that will get you a diagnosis of diabetes. The other way to do it, which is better, much better actually, is A1C, and that's short for hemoglobin A1C. And what the A and the C stand for is too complicated. I'm not going to go there, but the bottom line is when you eat too much sugar, when your pancreas isn't producing enough insulin, when your blood sugar is dysregulated, when it becomes elevated, when you have hyperglycemia, elevated blood sugar, that will cause that elevated blood sugar, some of that sticks to your red blood cells. So glucose binds to red blood cells. And that's why it's such a neat test, because you can measure, how wouldn't it be neat if there was a test where you could measure not just how high your glucose was yesterday, or how well, more specifically, the fasting blood glucose test that you've all done it. If you go in for any standard blood work and they tell you to fast, that's one of the main reasons they tell you to fast. And so the first thing in the morning you see is your blood sugar above 125, is it above 100? And that is a reflection of how well your body handled whatever you ate yesterday. If you ate salads and, ate really healthy food and not a lot of carbs, then your glucose is going to be normal the next day. If you ate a lousy diet, it will probably be elevated. If you ate something in between and are not aware of it, this will show you, are you entering the pre-diabetic phase? So diabetes is a fasting glucose first thing in the morning of 125 or higher. Pre-diabetes is 100. So diabetes, 125, pre-diabetes, anything above 100. Why is that? Because anything above 100, anything above 99 in your blood sugar is going to start to damage your blood vessels and your nerves. The other test is A1C. So how that works is your red blood cells live about 3.5 months. And throughout their lifetime, when they're floating, flying through your bloodstream, some glucose sticks to your red blood cells. And it's a very direct correlation. So you can get your average glucose, all the peaks after every meal and the valleys in between meals, up and down, your glucose is going up and down. And all that time, 24/7, 365, some sugar, some glucose is sticking to your red blood cells. And so anytime you measure hemoglobin A1C, that is measuring, on average, 3.5 months of the peaks and valleys in your blood sugar, because red blood cells live about 3.5 months. And so the amount of sugar, glucose that's stuck to your red blood cells at any moment is a reflection of the past 3 months, because that is the average time lifespan of a red blood cell. So that's a really important test, and A1C above 6.5 gets you a diagnosis of diabetes. An A1C above 5.6. It used to be 6. This is one of the good examples of when the blood tests get narrow for good reason. So a bad example of that is they lowered the normal ranges for cholesterol so they could put everyone on statin drugs. But it is good that the labs have acknowledged that and recognized the latest research to show that an A1C above 5.6 is going to represent damage, elevated glucose sufficient to begin damaging your blood vessels and nerves. So pre-diabetes on an A1C test now is 5.6. It used to be 6. It used to be 6.0 for many, many years, I think since the A1C test came out, but it has recently been lowered to 5.6, and that's a good thing. So if your A1C is above 5.6, that is pre-diabetes. Well, what if both of those are normal? What if your fasting glucose first thing in the morning is 99 or less, and your A1C is 5.6 or less? That means you don't have prediabetes, right? Not necessarily. That's what you'll get told by any other practitioner. But say you have a family history of diabetes and you want to be proactive and make sure you don't get that. Say you have a sweet tooth and you love to eat a lot of sweets or a lot of carbs, a lot of bread. I usually don't say carbs, but it's kind of unavoidable because that's what everyone else wants to talk about. But it is an important distinction. I prefer to talk about grains, starch, and sugar, because there are carbs in broccoli and spinach and kale and, in every vegetable and fruit, there are carbs. So the ones that, and there's, you can't eat too much spinach or kale, most vegetables, it's very difficult to eat too much of those, even though they have carbs in them. By contrast, it's very easy to eat too much bread, too much pasta, too much rice, too much potatoes, too much sweet potatoes. Are sweet potatoes good for you? Well, the words right there, they're sweet. They have lots of nutrients in them, but they're sweeter than regular potatoes. So for purposes of controlling your blood sugar, if you're diabetic or pre-diabetic or want to lose weight or have an inflammatory condition that is driven by consuming too much sugar, then no, sweet potatoes aren't good for you. It doesn't mean they're bad all the time for everyone. But yeah, the problem, if you're worried about your glucose becoming too high, trending into prediabetes, or for example, have an inflammatory condition. What if you're young, you're otherwise fit and healthy, not overweight, but you have some kind of inflammatory condition that, a gut dysbiosis. You have gas, bloating, nausea in your gut, and it's difficult to figure out why. The definitive way to figure out why is to do a comprehensive stool test to see what your microbiome, do you have sufficient healthy bacteria in your gut? Do you have too many bad bacteria in your gut? Do you have a pathogen in your gut? The stool test will identify all of those, but even without doing that, it's just important to know that sugar feeds the bad bacteria. One of the reasons people crave sugar, and one of the reasons you have a favorite food of any kind, is because that's the food the bacteria in your gut like. They're the ones that the bacteria in your gut send out chemical signals that cause you to crave the food they want. They're controlling your life. They're telling you, feed me, give me more of that. And sugar is the main one. So eating too much sugar or any carb, any starch that breaks down into sugar very quickly. By the way, on that subject, the worst offenders are any liquid sugar. So the worst sugars are soda, fruit juice, beer, sweet liqueurs, sweet wine, sports drinks, sweetened sports drinks, sweet tea, any kind of liquid that tastes sweet, and even some that don't, like beer, because beer has a lot of starch in it that becomes sugar almost immediately when you consume it. Those are the things that will spike your blood sugar the most. And this is easy to remember. What do you give a diabetic who's, passed out on the ground because they're having a hypoglycemic crisis? You give them orange juice, because orange juice immediately spikes your blood sugar. Well, if something fixes a hypoglycemic episode, it's probably not a good idea to drink that every morning for breakfast, because it's going to spike your blood sugar anytime you drink it. So it's good for some people, most people, to eat some fruit. But if you're concerned about maintaining healthy blood sugar levels, then it's a good idea, in my opinion, which is not most people's opinion, but in my opinion, for a lot of people, not everyone, but for a lot of people, to not eat much fruit. You need the antioxidants and vitamins and minerals that you can get in fruit. You can usually get in vegetables as well. Berries are great. Blueberries, raspberries, they justify their sugar content with all the antioxidants and other phytonutrients they have in them. If you can get wild strawberries or just any kind of strawberries that are small and not super sweet, which is hard to find because everyone likes strawberries that are as big as possible and super sweet. But if you can get small, not super sweet strawberries, those are great too. Blackberries, any kind of berries are great. And there are some other fruits that are okay. Send me an email if you have further questions about that. But what if your glucose, first thing in the morning, fasting glucose is normal, or even when you check it, if you borrow, probably not going to have them, but some people, I encourage some people who are, again, the same problem, maybe if you're not diabetic, you can check your blood sugar anytime you like with a standard glucose meter. I'm not going to go into that now, but it's useful, and continuous glucose monitors are available now. Some athletes do that just to measure their glucose throughout the day for various reasons. But say your glucose is normal, fasting or during the day with any kind of measurement, and your A1C is normal, but you still have a familial risk. You have a family history. Your dad, your mother, your sister, or your aunts or uncles, or you have a family history with a lot of diabetes, and you want to be proactive and make sure you're not going to get diabetes. Or if you're overweight and you have low energy. We started on this pre-diabetes, not full-blown diabetes, even pre-diabetes is one of the 12 most commonly overlooked causes of fatigue. So because having too much blood sugar, consuming too much blood sugar raises your blood sugar, and then your pancreas pumps out a bunch of insulin to bring your blood sugar back down, and that causes a period of hypoglycemia. A reactive hypoglycemia. So you get to sugar peak. A lot of people, they're in this cycle of up and down glucose, up and down sugar, start their day exhausted, have a coffee and a donut, so you get caffeine and sugar to help get you going, and then at 10 o'clock, an hour or two later, you need a candy bar or another donut or some other kind of sugar or more caffeine to keep you going, and that's because you're getting that reactive hypoglycemia, that drop. It causes depression, it causes anxiety, it causes fatigue when your blood sugar goes down, and it can take a while to recover. And so low blood sugar is caused by eating too much sugar. It seems counterintuitive, but if you eat too much sugar, it causes a spike, which causes an insulin hit to bring your blood, to escort that sugar into your cells. And then if you're not exercising, not burning that sugar, your pancreas tends to overreact and you get a dip where your blood sugar goes down too low for a little while. And that makes you crave more sugar. That causes cravings. It causes fatigue, anxiety, a whole host of other mood disorders. So the better way, or the way that's important for some people who are concerned, have those concerns and have a normal glucose and A1C, is to check your serum insulin levels. Just do a blood test for insulin. What is the amount of insulin in your bloodstream right now? That's actually really useful. And again, most doctors don't do this because there's a broad medical range. If you're within that, you're fine. They do it if you're diabetic, because if you're diabetic, it'll go up too high early on because your pancreas is overreacting. And then eventually, if you're full-blown diabetic for a long time, your pancreas gets worn out and can't make enough insulin anymore, and then it goes way down. So the same principle applies before you become diabetic. If you're pre-diabetic, even before your fasting glucose goes up and your A1C goes up, if you're eating too much starch and sugar and you're not burning it off with regular exercise, and it's getting shoved into fat cells or just cruising around in your bloodstream for too long and creating inflammation and other havoc, your serum insulin level will go up a little bit, just a little bit. So if everything else is, and it's a little bit complicated, it doesn't really make much sense to test this by yourself, but if your A1C is normal and your glucose is normal and your triglycerides are normal and a whole host of other things on a comprehensive blood panel are normal, but your fasting serum insulin is elevated, that proves that you're eating too much starch and sugar because there's too much insulin in your bloodstream right now, and it's eventually going to cause your fasting glucose and your A1C to go up. I'm Dr. Todd Binkley. You're listening to Safe, Effective, Natural Solutions. Thank you for tuning in. Email, text me anytime if you have any questions. Dr. Binkley at binkleyhealingcenter.com. You can text me at 805-218-3939. The ringer on that phone is always off. I don't answer the phone when people call, but I will. I do check it for text messages. If you want to speak to me on the phone, I'm happy to do that too. I just need to call you instead. Just leave a text or an email saying, please call me. Happy to do that. I always love getting your questions. And even better way to get your questions answers is every month now I'm doing a live presentation in my office on various topics. It's the first Wednesday of the month. Every month I've done one I did one on diabetes a couple of weeks ago. That's always the best attended one. I did that live diabetes talk at Community Memorial Hospital a few years ago, and they had the best turnout for their Heart Aware program they ever had. I had 70 people there, got really great reviews. So I love talking about that. I love doing live presentations in general because it's just a great way to see you face to face, answer your questions directly. And I've already got so many PowerPoint presentations that I've done over the years, and I update them periodically. Over the past few months, I've done presentations every month, first Wednesday of the month. I've done them on toxins, hypothyroidism, diabetes, heart disease, hormones. The next one, April 1st, is going to be on osteoporosis. So mark your calendars, invite your friends, RSVP, let us know if you're coming. April 1st, no fooling, osteoporosis. Going to be doing a deep dive into that, how you can prevent it, how you can reverse it without drugs. So who do you know that has a family history of osteoporosis, who's had a DEXA scan come back and they say they have osteopenia? There are ways that much better. Don't take those drugs. Fosamax, Boniva, there are much better ways to stop the progression of and even reverse osteoporosis with nutrients, with calcium, with collagen, with vitamin D and vitamin K in appropriate amounts and forms of those, especially the type you take, is what matters most. In case I didn't say it enough, the most important thing to do if you have diabetes or pre-diabetes is to exercise. Sugar will burn off if you move your body. If it's ever high, go run around the block, walk. It'll go right back down. Test it. Proper testing is always the key to find out whether or not you are truly healthy or not. I'd love to help someone you love or you yourself find out how healthy you are so that you can live long and live well. Have a fantastic weekend.
Tune in every Friday at 2 p.m. and Saturdays at 3:30 p.m. for safe, effective, natural solutions right here on 98.3 FM, The Word.